Hello everyone, my name is Shirab Mumtaz. Today we're gonna discuss about the action potential blocking agent. Okay, as we discussed it earlier, how the action potential is generated, the things, the depolarization, repolarization, and all that. Okay, so we're gonna discuss the article. Okay, so in this exercise, in this experiment, okay, they utilize the a Frontscheidt nerve, okay, and observe the components of the action potential. Okay, so right here, the overview of this article is the monitor and calculate the compound action potential from the frog leg, okay, nerves, from the living frog nerves, okay, and test their physiological responses, okay. So the local anesthesia, okay, compromise that blocking the agent, the sodium channels, okay, group of molecules that actually structurally similar, okay, and are used for a variety of applications. Okay, they're different, like in the same group but different anesthetics. Okay, which we're gonna go in detail later on. The same mechanism of this local anesthesia, there is a common mechanism, okay, which is the inhibition of the voltage-gated sodium channels, okay, and then actually which actually decrease the propagation of the action potential. Okay, all right. So right here, this is the actually this is the local anesthetic, and then we have same of the structure, which is the tricane methyl sulfonate. Okay, so right here, which is the one of the molecule like MS2. So as we know we have the procaine, lidocaine, tetracaine, and benzocaine. Okay, for the local anesthesia. Okay, so now learning objective is that this molecule it's got the ionic mode, discrete the ionic movement that produces an action potential in the nerves. Okay, so describe how the local anesthetic inhibit the voltage-gated sodium channels. Okay, and the normal physiological process of action potential generation and conduction. So both things are inhibited. Okay, so action potential generation and then conduction as well. Okay. So analysis, as you can see in this picture, that how the effect of the MS222, which is right here, which is in red, how it blocks the vertical action potential generation. Right here, the normal, okay, the action potential generation, but the action potential is inhibited after the ingestion or the and not intermittent ingestion, but putting in these agent causes the decrease of the action potential, which is the voltage gated sodium gated channels blocking agent. Okay, so as you can see right here, 0.1%, which is right here the 0.1% right here that we put in MS222 in a single frog nerve, okay, which is the sciatic nerve. Show the comparison that how it is comparison with the response after 1 minute exposure of the anesthesia. So right here after the 1 minute of the anesthesia, the response have been reduced. After 10 minutes and 20 minutes, all the call age the effect has been gone. So we can imagine that how you can see that for how long we can put this agent, and how we can imagine that predict that how long the person not gonna feel any pain, and then do our procedure with a simple procedure. As I had a procedure too, removal of my pus from my forearm. Okay. No. Anyways, so analysis shows that that after the initial depression and activity of the which is the action potential, the nerve recovered its activity the period of 10, 20, and 30 minutes completely. Okay. Note that the nerve respond better after 30 minutes recovery than before anesthetic treatment. Okay. So in average, we have now we call the action potential amplitude in reaction to the intermediate, okay, stimulation before, okay, as we see right here, and then 1 minute after the ingestion or the putting on this MS222 therapy. Right here, right here, everybody getting this injection at the same time. And then after 10 minutes, you can see that that how they're like, they are getting recovered. Okay. So right here in this picture, you can see right here that the amplitude is less, but after 20 minutes, the action potential has gone back to its normal uh, amplitude. Okay. So the conclusion is that the immersion of the sciatic nerve with the zero point zero 0.01 of the MS-222 for 1 minute, okay, should cause the marked suppression of the action potential. Okay, the responsiveness of the anesthetized nerve should recover by within 20 to 30 minutes. So complete suppression of the action potential means that, like, that all the nerve axon has been inactivated and no further message has been delivered from the neuron towards anywhere else, which means, like, towards the toward the brain. Thank you very much.